name is Carrie Goslin, and I am the Program Manager for Value-Based Services and Outpatient Services for TriCounty Mental Health, located in Lewiston, Maine. Approximately 4 years ago, we enrolled in the TCPI in partnership with Northern New England PTN. Since then, with the use of Maine Health InfoNet, our organization has been really successful in achieving a benchmark performance in reducing the amount of emergency department and hospital visits with the clients that we serve. Some of the performance measures that really sets us apart is the ability to provide walk-in services for our clients for immediate access in order to avoid emergency department visits, utilizing real-time alerts and data from Health InfoNet, which provides us prompt notification of a client's admission or planned discharge, and having defined roles of our health home coordinators to provide transitional care with warm handoffs, discharge planning, reconciliation of medication management issues, and scheduled visits. We currently provide value-based services of behavioral health homes to approximately 900 clients in Maine and have identified a subset of clients who are considered high risk for emergency department utilization. We receive push event notifications from our Maine Health InfoNet exchange anytime they visit the ED or are admitted to our partner facilities. We have MOU agreements with inpatient facilities, EDs, residential facilities, crisis services, and corrections, which allow for prompt notification and response from our behavioral health teams. We have also improved the number of patients on the wait list from 70 to less than 30 on average. We educate our clients about appropriate use of ED visits, which has reduced our ED utilization by 13% for these clients. These proactive approaches have helped us to contribute over $2 million in overall cost savings from our organization to Medicare and Medicaid. Vicki and Katie, you guys have been working together for about 9 years now.
Yes.
That's wonderful. Vicki, would you mind providing a brief overview of your work with Katie so far?
When I started working with Katie, I started going out of the BHH. We go to the medical appointments. And then Katie was going to the emergency room a lot. I tried to figure out a way that she could understand and really get to see how her going to the emergency room is costly and not meeting her needs directly as it should be. I came up with a way of having her see if she went to the emergency room, if she had to use her own money, it would cost her $100. If she went to urgent care, she would pay $50. And if she went to her PCP's office or called, it's free. So with her being able to have a visual of that and see how that would work, she started saying, okay, this pain is a level where I think I should go to urgent care. And after we kept working on it, she got to the point where she could say, no, I think I can call my PCP, see what they recommend, and I'll follow his recommendations. And to this day, that's what she's been doing.
Katie, would you mind discussing how our BHH program and working with Vicki has helped you in your success of being over a year now free of going to the ER? That's amazing.
Yes, it's been a year and a month. I have not utilized my visits to the emergency room. Going to urgent care or emergency room frequently, I felt like I was always being judged, treated different, and like the doctors thinking, oh, she's just in here for pain meds, she's a drug seeker. And I really wanted to change that.
Really working with Vicki and reducing the amount of times of utilizing the ER, that you've really gotten your needs met by talking to your PC and building that relationship together.
Oh, absolutely, because basically at the end result, they basically will say, follow up with your PCP.
Yeah, definitely. And not to say you definitely have had legitimate medical concerns and conditions over the time, but really learning how to properly utilize the services that are available to you and knowing when it's appropriate to go to the ED or urgent care or just follow up with your PCP like they usually say, right?
Yes.